Do we have Ismail ready? Ismail, if you can hear me, please go ahead and give your remarks on behalf of the State Department of Gender. All right. As Ismail is still getting ready, we can now proceed to the next section or segment of the validation. And that is now the crux of the matter. So I want to invite EDRAC Associates, led by Bill Ouko, to now lead us in the presentation of the research findings. Bill, welcome.
Thank you very much, Christine. Can you confirm if you can hear my voice?
Yes, we can hear you loud and clear.
Can you confirm if you can hear my voice? So my name is
yes, we can
Bill
hear you loud and clear.
From EDRAC Associates. If you can hear I'm the team lead for the assignment at EDRAC Consulting. I'm joined with a number of team members who are going to introduce themselves on the chat. We shall be presenting this presentation with my colleague Jane, who is a gender expert, gender consultant. And so we welcome you all to this presentation. Let me just put up the presentation and see if you're able to check it out. I hope you allowed me to have sharing rights. Please give me rights to share. So far, I don't have any sharing rights. Christian? Okay, let me try that. It's okay. Confirm if you can see my presentation. Christine, are you able to see my presentation?
Yes, we can. Go ahead.
Is it in presentation mode? Is it in presentation mode, Christian? Okay,
yes,
lovely. Yes, and thank you to COVAW and the speakers who've just taken up the initial sessions for giving very clear background about the projects, about this research and participation of women and girls with disabilities in ending violence against women and girls. I think for us as an opening remark, it has been an interesting engagement working with COVAW, DIWA, and all the stakeholders in putting this activity into fruition and getting to the final report. So ours is really to just appreciate the partnership, the collaboration, and all the inputs that we got from different stakeholders, including various reviewers who provided really good feedback that went all into improving onto the final report. And this being a validation meeting, we are open and happy to have as much feedback. Perhaps there'll be very little time this morning, but please, you can put all your feedback on the chat, even as we present, so that we do not interrupt the presentations and allow, we will be following through those chats. We will be able to respond to as much as possible within this call, but importantly, take all the comments that will come in into consideration and perhaps embed the same in the final report that we've already shared. The background has been well covered.
Excuse me, Bill. I can see Ruth's hand is up. I don't know if she wants to tell you something.
Sure.
No, it was a long time. Sorry. No, it was a long time ago.
Okay. That's okay, Ruth. That is what in the previous COVID period we used to say, an old hand. Yes. So Ruth, you're okay? You're able to see my presentation?
I'm good.
We will try to run through as much as possible. In some slides, you might find the report a little wordy, but we are not going to follow those wordy. It's just to make sure that for those who like to perhaps read slides, they are also able to quickly just peruse through even as we present. So in terms of the background, I think we've really been able to provide a good background about the research, which is on participation of women and girls with disabilities in ending violence against women and girls movements in East and Southern Africa. This was particularly done in 3 countries of Kenya, Malawi, and Rwanda. And of course, this was informed through the project implementation areas, has been explained by Christine and the COVAW team. The research was ably led by COVAW in partnership with DIWA, and of course, the implementing or what would we call the funder, the United Nations Trust Fund, in their program that they are implementing, which is titled Inclusive and Empowered Feminist Movements in Africa. Christine has given us enough background on the projects, where they are now, the challenges, and even the onward-looking plans in terms of growth of the project, and in which case this research also becomes very important. We are EDRAC Associates Consulting. We are a consulting firm based in Kenya. We work in all areas around monitoring evaluation. We do technical assistance, program implementation, and largely all the donor-funded program support and technical assistance. Largely in health, gender areas of work. We will move straight to the next slide, and perhaps ask my colleague Jane to just pick up a few of the introductory slides, and I'll come in at the methodology section, and then we'll transition as we go. Jen?
Thank you. Hello, everyone. Our protocol observe. My name is Jane Wasonga of EDRAC, and I'm grateful to be here this morning. The slide has disappeared. Okay. So, yes, hold it at introduction, please. Yes. So, kindly don't move it. Thank you. We are grateful because we looked at it globally, internationally, regionally, and even nationally per country to present specific. So internationally, we in reference to United Nations Convention on Rights of Persons with Disability and CEDAW 2023, the reports that we have had and we have seen and know that they argue that the movements led by women with disability have been left out and left behind. And so the research was looking at the inclusion, particularly the study examined, are women with disability mainstreamed in the women feminist movement? So that was the particular interest, that are they effectively there? And if they are there, are they effective? What are the challenges? So the topic is participation of women and girls with disability in ending violence against women and girls in the movement in East and Southern Africa. So with the description of marginalization, a part of it has been said, that women and girls in terms of accessing resources, partnership has been left behind. So we significantly looked at the efforts to address violence against women and girls with disability. I thank you. So in terms of the research objectives, we had 5 objectives, which are so broad and looking at the whole perspective of leadership, gender, and disability. So first was to map the EVAC movements in East and Southern Africa, And then 2 is to identify unique forms of sexual gender-based violence faced by women and girls with disability. The third one is to assess the level of inclusion and participation of women and girls with disability in the movement. This is to understand particularly the level of representation, the COVID. And the fourth is investigate and analyze the enablers and barriers that hinder participation of women with disability, women and girls with disability. And the last one is to collect and document the best practices for strengthening the participation of women and girls with disability. And now we have the research questions which are answering this, like the 5 of them in relation, what is the EVAC movement networks in East Africa? So the second one is what are the unique forms of violence, gender-based violence faced by the women with disability and girls? The third one is what is the level of inclusion and participation of women with disability, women and girls with disability in the movement? The fourth is what are the barriers that hinder participation? And the fifth one is looking at the best practices that strengthen the participation. Yes. And now, this gives us the background and rationale for this research, looking at the research gap. So we realize that women have been excluded from the mainstream, particularly the women and girls with disability have been excluded from the mainstream feminist leadership. And so with that background, we are looking at what is the justification, what is GESI? GESI is gender equality and social inclusion. Does it include, are women with disability included in the movement? And if they are not included, what is the reason and the justification? So in terms of representation and participation, what is the effectiveness? Well, in terms of the institutions, research, and so the research was to provide the evidence, including indicating the participation, indicating that the women are present, and women and girls are present, and if they are not present, what is the reason? So basically the mainstreaming of women and girls with disability into the movements in policy, legislation, executive levels, resulting into equitability. Thank you. And then we looked at the knowledge gap in terms of inclusivity and development, whereas the representation is power, what we feel, and enabler, but satisfactory, what does it mean on reality? From the narrative that is commonly understood, the effectiveness of participation, looking at what Roland Wood said, and even picking it from the UN Women, that there is nothing for us without us. That is the narrative of the saying that if they are included, how far? What is the level of decision? Is it top down or bottom up? So nothing for us without us is the core of it as far as participation is concerned. So we were looking at where is the level of participation and what does that mean? So in terms of inclusivity, what are the enablers? What are the barriers in facing the women with disability? What are the plans? What is the policy and legislation? What is the capacity gap in looking at the unique challenges? Stakeholder mapping in terms of engagement of who are the collaborating partners, and where do we stand in relation to working together, looking at Agenda 2030, looking at Africa Union 2063, looking at the Africa Union Charter of Disability, and working with everyone, leaving no one behind. So the policy practices are like that. So the research outcome is expected to give evidence that what is working, what are the best practices, what can be replicated, what can be improved. Thank you. Yes. So we looked at several literature, both internationally and globally, country-specific, looking at the country policy framework, looking at the global framework, in line with CEDAW, in line with United Nations Convention on Persons with Disability, in line with Africa Union Charter, how the member states are implementing it, how country-specific, looking at the sample countries that we had picked, the 3 of them. So this has helped us to explore particularly issues of gender, disability, and representation in the realm of leadership. What are the specific identifications? So in terms of the policy level, legislation, and implementation? I don't know if I'm going too fast for the interpreter. I think so. Let me slow down. Yes. So the conceptual framework, we were looking at the independent variables, intervening variable, and so what is the end product? What would the outcome of this assignment? But again, we narrow it down. We have a diagram in the report, main report, but here we just highlight the key points, like what did the study examine, the perceptions, the attitude, the policies that in view of women and girls with disability as the target, and what are the sharp connections between strengthening leadership roles and amplifying their voices so that their unique challenges are also heard. So I've talked of stakeholder engagement and advocacy strategies. So this particularly is the conceptual framework look at the streamlining the agenda and the outcome of the research and the best practices. Yes. Yes. So theoretical framework gave us the guides. We used, the study was guided by 2 theories, the social feminist theory, which advanced the ideas of socio-cultural attitudes, which exploit with exploitation and intersectional, looking at the social issues. It provided the framework for understanding the impact of female underrepresentation. It raised the issue of inclusion, representation. I have to go slow. I've learned that I was making the interpreter move very fast. So the social feminist theory raises the issue of inclusion, representation, power, attitude, and decision-making. The second one, we looked at the intersectionality theory. This advances the forms of discrimination, oppression, in various forms of, in line with planning, participation, accessibility, ownership, and control. It helped us to examine which subgroup of disability is mostly disadvantaged, but we did not go core into disability past each one of them, but just generally mentioning, was looking at the underrepresentation and representation and why. So the intersectional barriers, we looked at the gender equality and disability inclusion that shapes the inclusion. So that's the theoretical framework. Yes, and so that's the theoretical framework that guided the study. Now we can do.
Yeah. Thank you.
Yes, Bill,
I can take it up from the study design.
All right.
So in summary, we used a cross-sectional study design. So we used, as Jen has mentioned, the participatory social feminist approach, as well as the intersectionality approach. Largely, we used a quantitative approach for this. It was done jointly with all the stakeholders. We had IDRAC drafting these instruments and sharing with the stakeholders. COVAW, IWA, and the teams were very useful in providing feedback to them. So we had literature review guides. As Jane has said, we had a couple of literature across local, regional, and even global literature around the subject matter that we reviewed, and we provided a full literature review write-up, which is also part and parcel of the report if someone would like to go deeper into that. We had the focus group discussion guides, in-depth informant interviews that were targeting key informants in the sector, in the movements, and as well as in the leadership across the 3 countries. We had key informant interviews, as well as semi-structured questionnaires, that we utilized for online survey. These were largely closed-ended questions, which were also enabling us to close up on some of the follow-up questions we had in all the tools that we had shared. In terms of sampling, we used purposive sampling technique, and of course, stratified sampling that was utilizing probability proportional to size. You remember that we had 3 countries, different populations, as well as an element of limitation of how much we would cover within the period to address the 5 objectives in the 3 countries. So we believe that this design and methodology was useful to us in reaching out to a sample that we could easily, utilize the findings and generalize them as really findings across the 3 countries. So in terms of focus group discussions, for instance, we had women and girls with disabilities. We had 3 groups each in the country. So we had like 9 FGDs. In EVAC movements and network representations, we had 5. So we had in total 12 focus group discussions. We had key informant interviews and in-depth interviews as well. We conducted in total key informants and IDIs almost 161 in total. And of course, semi-structured questionnaires, which these questionnaires post-development, there was a whole process around taking through the enumerators on the questionnaires, translating them into local languages, and also using interpreters where necessary when they were being administered at data collection level. So we in total, had about 170 target population in Malawi, 97 in Rwanda, 134 in Kenya, in terms of these various leaders in the various sectors that we have there. So what was our inclusion and exclusion criteria? So the inclusion criteria included the women and girls with disabilities. So we are saying women who self-identify as women or girls with physical, sensory, intellectual, or psychosocial disabilities. So we did not leave any disability out, as long as there was self-identification. Age between 18 years and above with informed consent. And for those that were aged below 18 years, we had to secure parental or guardian consent. And then we followed through to organizations of persons with disabilities, and these were various of them. I think we've already listed them. And we also actively engaged advocacy, leadership, or support services related to disability rights and gender equality, or ending violence against women and girls stakeholders. So in terms of the movement leaders, we looked at recognized leaders, activists, or advocates working with these movements. Those also were willing and also able to provide informed consent, that they were available to participate in all key areas, both the focus group discussions, in the key informants, and the in-depth interviews. And those are also willing and were able to really complete questionnaires. Those who are comfortable communicating in the language of the data collection representatives or within the interpretation and assistive support that was working. What we did here is that we know that there are varied levels of literacy. There's varied level in the 3 countries, the different languages. So we, as much as possible, ensure that in each context, we had individuals that were able to respond and provide, the responses that were required for this. Who were excluded were movement leaders whose work is related to ending violence against women and girls, or those who lack experience in gender and disability inclusion, because some of those responses perhaps would sway the outcome of the research. Also, individuals who are unwilling or unable to provide informed consent were respectfully allowed to take that view. And also participants whose participation may have posed perhaps ethical concerns. So for instance, if you had perhaps respondents who were at that particular moment going through perhaps some forms of violence, then those were excluded and allowed to really just go through what they were going through at that point. Also, to ensure the confidentiality of participants was upheld, so we provided all informed consent across all respondents. And of course, the participants who could be survivors of GBV were also covered in this sense. So in terms of data collection, we used designed tools. We digitized some of our tools on COVAW. And of course, we conducted a pilot through both the FGDs that we were having, and also, of course, the COVAW collects after digitizing the questionnaires. And post that, of course, utilizing the statistical approach, we were able to upload all the data collected from COVAW, transfer it into SPSS version 23, and that is what we used for data analysis, analyzing, creating tables, and thereafter utilizing that to make conclusions. So you see the data that we present is largely descriptive statistics in terms of tables and charts, looking at trends across the 3 countries, but really more guided with the 5 objectives of the study and the questions that were set, the research questions that were set. Of course, we also used a statistical method, so the confidence intervals were covered through, and we used inferential statistics techniques, like ANOVA, which we computed and used to really examine all the variables of interest in this research. As my colleague Jane has mentioned, we also looked at that feminist theory interlinkage. So we interlinked with statistical approaches of theory, which inform understanding and kind of conceptualizing gender roles and advocate for inclusion of women and girls' interests in social organizations. So we were able to pick through this theory and what it underpins. We took that into consideration in our analysis, and therefore were able to create the results that we're able to present today. We, as I mentioned, used the ODK, Open Data Toolkit, in handheld devices, which then was utilized to pick data. As I said, we used descriptive statistics using SPSS. And of course, we also utilize Microsoft Excel largely to analyze most of the quantitative data. Consent, issues around do no harm, cultural appropriateness were all considered during the process of data collection, report writing, and even to the end of this process as we share this. So I'll call on my colleague Jen, perhaps, to come back, but to talk about the risks and limitations that we had. But I can quickly actually speak through that. So one of the limitations that I would start with really was the process of securing the research permit. And this, I think, COVAW COVAW has fairly covered. There was a bit of delay, and especially in terms of securing the research permit in Rwanda. We were able to cover Kenya and Malawi at the earliest point. And the Rwandan one delayed a little bit, and therefore, because it was a multi-country and one research, we had to wait for that process and be able to then complete data. We must say that this delay did not in any way, though, affect the results of the research. It only affected the timeline of completion, which took quite a bit of time. We also anticipated some limitations in terms of social desirability bias, issues around recall bias. We applied the GESI principles, but we also ensured that we trained the data collectors to, as much as possible, be able to give time to the respondents to reflect on the questions that they're asking, to look at individuals who have clear recall. By so doing, also utilizing different persons to respond and picking the highest response. As you'll see, in the quantitative analysis, it is looking at the highest number of persons who responded in a certain way, and that was taken care of really by the by already the number of persons that we identified, the sample size that we identified for responses, which was ideally adequate to make a conclusion. So in short, I think we all and everything go through this research, and we're happy to present the findings as they are for further discussions. Jen?
Thank you, Bill. That is well said. The findings, before we started, we did the pilot, and we piloted in Nairobi, and part of it also in Kisumu. So where we also were able to sharpen our tools and before moving to the direct data collection. So objective one, we also did our report according to objectives. So the first one is mapping of EVAC movements, network organizations in East of Southern Africa. So we look at several organizations. Some of them, we have just listed a few. The FEMNET, Africa Women Development and Communication, Solidarity for Africa Women Rights, Sexual Violence Research, some of them are with us. Gender is My Agenda is a global campaign network under Africa Union. Girls Not Bride is also a global platform for gender-based violence. We looked at the Africa Regional Sexual Men Engaging, some of them that we have listed here are global. And then for country specific, we look at organizations that network within the country, within Africa, but we were also looking at this mapping, this global organization, when they overlap to countries, are they known? What is their role in terms of participation and collaboration with the member countries or country specific? So that one is well highlighted in the report. We have touched it as annex because it's a bit wide. And country specific, we look at Kenya, and there are a number of women-led organizations in the CSOs. But in terms of analyzing women with disabilities, so our data shows that out of the 21 sampled, 15 were women-led organizations, but out of those 15, only 6 were women with disability, who are also coming from the OPDs, Organizations of Persons with Disability. The same in Malawi, the 13 from Organization of Persons with Disability. And Rwanda, the same trend. So we realize that most of the women-led organization, we are the feminists and in the movement, the women with disability are still not represented. There are they are represented in the organizations of persons with disability, but not in the movement. So we are saying 80% of feminist and women-led organizations advocate for women's rights, but they have not included the women with disability in their leadership. Thank you.
Thank you,
yeah. Yes, so I think maybe Bill, you can do this, then I just take water.
Certainly. So in terms of unique forms of sexual gender-based violence faced by women and girls with disability in East and Southern Africa, this is the objective 2 question that we are following. The first graph here is just showing across all those countries. One of the unique ones that stood out was emotional and psychosocial violence, which was highest at 52% across, followed by physical violence at 41%. And then you have the sexual, economic, and institutional violence largely below 30%, with sexual violence at 24% and institutional violence being the least at 17%. But we also went ahead and broken this groups bar graph into country specific. So if, for instance, you look at economic violence, if you pick that out, you realize that 54% is Kenya, 28% in Malawi, and Rwanda at 15%. But if you went to look at emotional violence, for instance, Kenya would still be at 62%, Malawi 49%, and Rwanda 46%. So one of the things that we realized around these unique forms of violence, and I will show that in the next slide, is that the context did not actually change. They did not bring any big difference in terms of the nature of violence that we had. For instance, on this slide, you'll see the purple slide is harmful cultural norms and stigma. So you'd see that it's consistently high in Kenya, high in Malawi, and high in Rwanda, averaging about 55 to 60%. If you look at physical and visual disabilities issues, you also see 46 in Kenya, 52 in Malawi, and 44 in Rwanda. So the bars, for instance, that is green, are consistently across these 3 countries. And yet, these are varied forms, and we were looking at context specific. So we are just saying the context did not actually matter or did not come as a big difference across the countries. What was actually critical is the commonalities of the type of violence that we were examining. And that's why I've said, for instance, if you looked at harmful cultural norms and issues around stigma, it stands out across the 3 countries. If you look at physical and visual disabilities, it stands out across the 3 countries. If it's about inaccessibility or unresponsiveness of the justice system, it also stands out across the 3 countries. So there was a little bit of homogeneity in terms of these issues across the 3 countries, and almost leveling at different percent if you're looking at 1 on each for each of the countries. In terms of intersectional vulnerabilities and issues around underrepresentation, again, we looked at, for instance, physical and visual disabilities. You have Kenya at 46%, you have Malawi at 52%, and Rwanda at 15%. But when we look at the disproportionality in terms of age, socioeconomic status, rural versus urban, we don't have much difference. The blue section on that bar is a socioeconomic status. The very bright color, I don't know whether that should be magenta or orange, is age. And then we have rural versus urban, which is yellow. But each of those sections across the 3 countries, if you see the trend, is that they actually do not have any significant differences. Of course, the socioeconomic status was wider, and that is both for Kenya 62, Malawi 67, and Rwanda 58. But where you came to even a smaller portion in terms of age, they were also proportionately smaller across the three countries. And when you look at the factors around rural versus urban, again, the same trend was clear. So one of the key takeaways therefore there is that in terms of intersectionalities, vulnerabilities, and issues around underrepresentation, these demographics did not actually have a much difference in each of the three countries, but they actually scored similarly the same in each of the countries. So if you look at again across Kenya, Malawi, and Rwanda, women and girls with disabilities experience very high levels of violence. So we had emotional and sexual violence being the highest at 62%, and Malawi 49%, and Rwanda 46%. The survivors across all the three countries described emotional abuse as persistent humiliation, threats, controlling behaviors that sometimes is often accompanied by physical harm as well as sexual gender-based violence. So when we looked at our qualitative accounts in terms of fear of stigma and disbelief as a key barrier to disclosure, one participant actually mentioned and said, whenever I talk about what happened to me, people ask who would want me instead of asking me who actually hurt me. So the question moves away from a solution perspective to a stigma issue when they report these issues. And this is actually creating additional stigma and creating, an environment where those who are affected fear to disclose for fear, of course, being judged and being labeled within their communities. Kenya recorded substantially higher levels of economic violence at 54%. Again, this could be attributed to the fact that if you look at the economic indices for the three countries, Kenya would slightly be higher than the three other countries. But yes, in terms of the analysis, it actually recorded 54% issues of institutional violence, 31%, which really reflect deeper structural vulnerabilities. And this we also got from the survey data of 2025, concurring with the same finding. One of the women shared that it was once yelled at by a healthcare provider on how they got pregnant, and yet they had a disability. So, qualitative findings get that caregiver dependence heightens exposure to abuse or neglect by caregivers who control access to food, mobility, medication, or assistive devices. This group of persons are ideally dependent, and therefore the caregivers play a critical role in their lives. In terms of survivors, survivors explain that their dependency is limited, or it limited their ability to report abuse or live harmful environments. One of the respondents shared that within the justice system, and these ones included inaccessibility to facilities, lack of sign language interpreters. One survivor actually explained that at the police station, they thought that I was ignoring them because I couldn't hear, and so they had to stay at the station for a long time. Being asked that if you don't want to speak, you'll stay longer until you speak. So at the end, after they understood this and there was at least an interpreter, they just let them go home without recording any statements. Another case also in Kenya, which was reported, a minor was taken to a correction facility wrongfully because of lack of access to information, leading to wrong judgment. So this was majorly due to poor sign language interpretation. So again, we realized that the caregiver, and especially also assistive facilities, for instance, sign language interpreters, to interface them within the communities and within their day-to-day engagements is critical. In Malawi, women describe silence driven by economic dependence and family pressure to resolve abuse informally. So they are forced to be silent, to be good girl, and not radical, yet being assisted. In Rwanda, survivors also emphasized communication barriers. So one of the participants shared that they listen to my family more than me. So they think I do not understand what happened. This also was in Kenya, with girls reporting always being left out in school because their parents cannot communicate, or prefer them to support other siblings as opposed to them. And so across all the three countries, really, the narratives are the same. The intersecting gender and disability norms, undermining credibility, restricting access to justice, perpetuating violence, underscoring the need for disability inclusion and survivor-centered programming that will address both structural and all these normative barriers. So there's need, of course, to train parents, caregivers, on sign language interpretation so that they're able to communicate to their children and discuss their issues, the issues affecting them, including issues around adolescent sexual gender violence, among others. Jen, do you want to take on the key findings around level of inclusion and participation, which was our objective 3?
Yes. Thank you. So this one is on in level of inclusion and participation. The prints are a bit small, but I'm trying. In terms of participation, Bill, just go ahead because the prints are too small for my eyes.
You're not able to see? Oh, okay, right, yeah. Because I'm projecting, I'm able to look at this. So in terms of level of inclusion and participation decision making, we analyze this per country. And we are looking at participation in community decision making, engagement in advocacy, involvement in campaigns, participation in policy processes. Across, for instance, for Kenya, the first chart there, we had all these sections trending as low as 28, 35, 31, and 18% in Kenya. That means that excessively above 65% in Kenya reported low participation, poor engagement advocacy initiatives, poor involvement in campaign awareness and social norms, as well as participation in policy. So they felt excluded, and participation was tokenistic, as we will explain in the foregoing slides. For Malawi as well, which is in the right side, it's the same trend. Participation 34%, averaging just 35% across. That means 65% and over also reported lack of engagement and inclusion, and in fact, in terms of participation as well. So this is the same trend that you'll see for Rwanda. Participation being 18%, involvement in campaigns 31%, engagement in initiatives 35%, participation in community decisions being 28%. So across the three countries, you would almost say above 65% consistently were reported really lack of inclusion in decision making, in issues around advocacy, campaigns, as well as policy processes, which I think is a big eye opener to this research in terms of saying how can this be turned around. Ideally, the bigger percentage should be the ones reporting that yes, they feel they're participating in policy processes, yes, they feel that they're involved in campaigns, awareness, social norms, they feel they engage in advocacy initiatives, they feel they participate in decision-making forums, but the coin is completely flipped to the extent that below 35% are the only ones who can report some level of inclusion for that matter. In terms of intersectionality and vulnerabilities and underrepresentation, so this is just a summary of the slides that we've already provided across Kenya and Malawi and Rwanda. Participation in EVA committees is moderate at average of 64%. Program inclusion is also relatively very high, 68 to 71%, and leadership representation is about half at 49 to 52% across the 3 countries, while consultation policy development remains comparatively low at 45 to 48%. So what would be the barriers hindering the participation of women and girls in EVAD movement? So this was part of our objective 4. If you look across that table for Kenya, Malawi, and Rwanda, issues around inaccessible policies scored above 70%. So there's a lack of disability-friendly formats, weak enforcement systems, and that was across all those countries. Weak institutional systems also scored above 80% across the 3 countries, which is inaccessible reporting pathways, lack of accommodation, the generally weak institutional systems that hinder participation in the movements. Limited legal support and enforcement, slow cases, lack of disability-sensitive procedures within the judicial systems also scored above 68%, up to the upwards of 74% across the 3 countries. And insufficient coordination between OPDs and EVA actors as well scored an average of 65%. So these barriers are cross-cutting across the 3 countries. And so we are actually saying that the structural barrier category is consistently high, above 65% across the 3 countries, as depicted on that table. But if for specific percentages, then we can check on that. The other barrier was attitudinal barrier. So we look at attitudes. What are those attitudinal barriers? Things like negative stereotypes about disability, people feeling that disability is actually inability. So that is perceived as incapable. If you look at across all of them in terms of Kenya, Malawi, and Rwanda, again, it's averaging 80%, plateauing from 77 to 82%. Issues around stigma and blame when reporting GBV, again, we are upwards of 70%, 71 to 76% average across the 3 countries. Issues around discriminatory attitudes by service providers also plateaued around 70%, 69, between 68, 64 and 69%. So that's still pretty high. Social or protection, limited autonomy, issues of perception that women and girls with disabilities are asexual or not at risk of violence, all went through at an average of 55%. So all these barriers, as we examine them one by one, are just giving the same standard response and near percentages across the 3 countries, and there was not any one that kind of was surprising based on the 3 country analysis that we conducted. We have the environmental barriers. We're talking about issues around GBV venues, rescue centers, police station, courts, inaccessible information formats like no braille, no sign language, or complex text. We're talking about lack of disability-friendly transport services, inaccessible community forums, poor safety and lighting in public spaces. And again, the story is the same. Under each barrier across the 3 countries, there was homogeneity in terms of response and percent limit that were represented there. Inaccessibility was averaging 75% across the 3 countries. Inaccessible information was even higher, averaging 85%. No braille, no sign language, complex texts that was reported as real barriers that hinder their participation. Lack of disability-friendly services, all average around 65%. In accessible community forums and EVAG meetings, again, averaging 70%. And poor safety and lighting in public spaces, averaging 60% across the 3 countries. So again, as I mentioned in the previous slide, we were hoping that perhaps across the different countries, we were going to get perhaps some outlier responses in either of these barriers, that perhaps one country would be way better than the other. But based on the sample size that we used, we found almost homogeneous barrier reporting rate across those countries. The final one was economic barrier. Again, same trend in terms of the areas that were looked at: limited personal income, exclusion from funding and grants, high cost of participation, issues around transport, assistive devices, communication aids, dependency on family or non-government organizations for financial support, as well as limited livelihood programs. They all scored really higher percentages, with limited personal income and poverty being the highest, averaging at about 80%, exclusion from funding and grants averaging 70%, high cost of participation averaging again 70%, dependency on family averaging 65%, and limited access to livelihood programs that also average 60%. So these barriers, and as they were reported, are really on high percent averages. That just speaks to the fact that there's much more work to do around these areas. Same that went for institutional barriers. So what really were the key findings in terms of gaps for meaningful participation? Yeah, they speak of policy consultations come with documents we cannot read, no braille, perhaps we've already said in some cases, no sign language interpreters, no simplified formats like big prints. And so even when we attend these meetings, we are not fully engaged. That's one participant who mentioned that. One of the other participants said, even when present in the room, decisions are made without our input. Yeah. Another respondent mentioned that in my village, even when there are meetings about women's rights, they do not consider women like me. We wait outside and our views are never heard. And particularly one of those interviews that we covered here in Kenya spoke about the fact that even in political meetings that are targeting women, so women groups or women-led leaders or women representatives, they attend these meetings, but they have no place. They are part of the crowd, they cannot be heard, and they're not given a chance really to speak, to give their input into the process, so they feel left out. We are shown in photos and reports, but we are not part of the planning or decision making. Kenya Disability Act was present. So disability status and representation, of course, is something that has been highlighted. But this is, a respondent saying that in many cases, even when they go for these forums, they will appear in photos so as to show that there was inclusion, but then there was no meaningful participation, or their participation did not count in the final decisions that were actually made. So this is just a summary of what we've spoke about in terms of structural barriers, legal representation, meaningful participation, accessibility, and also underrepresentation across those 3 countries. And I really do not want to follow them through. So the other one was best practice and opportunities to strengthen participation in EVAG movements. So one, we looked at inclusion models and successful partnerships between EVAG actors. We have community-led and survivor center approaches. We have capacity building strategies and empowerment initiatives, technology innovations for accessibility, policy and advocacy practice promoting disability inclusion, and country-level variations and engagements. So that I would explain a little bit more on this slide. Best practices that included mentoring women and girls with disabilities in leadership roles, co-designing community outreach activities, and using accessible communication formats, such as a sign language, braille, simplified text. Interestingly, these are not new kind of strategies or opportunities or best practice. They are known across the three countries. They are known by the actors, but for some reason, they're not put in place consistently and therefore remain still as barriers. Issues around co-facilitation of training programs for local authorities, creation of women and girls with disability-led advocacy committees, the provision of accessible meeting venues with sign language interpretation, mobility accommodation, and safe space is no-brainer. You'd expect that everybody has this knowledge, understands that this is what should be implemented. The policy document spelled it out. The UN Charter spells it out. But then implementation and ensuring that that's what is done still becomes a challenge. Same to all this, the approaches that foster trust, empower survivors, ensure that interventions reflect local realities rather than top-down assumptions. One respondent said, being trained as a peer educator allowed me to support other women with disabilities in my community. We can now identify and respond to violence ourselves, and our voices are included in how programs are run, not just decisions made for us. So at least you realize that when you empower the women and girls with disabilities, perhaps to be part and parcel, for instance, of peer education, they're able to, of course, communicate to their peers in a language in a manner that they understand, and therefore they feel included in that process, and that becomes a best practice. Again, but I say it's still no-brainer, because then this is really knowledge that is out there and has been documented in many literature. Capacity building strategies and empowerment initiatives that support technical and vocational training, equipment, materials, purchasing for income and marketing is also one of those best practices that we have identified as critical. So going into a bit of conclusion, I think the time has really gone, but we are happy to summarize this now, perhaps in the next 5 minutes, so that we can open it up. So in terms of conclusion, this study really just looked at involvement of women and girls with disabilities in ending violence against women in East and Southern Africa, but more specifically Kenya, Malawi, and Rwanda. The findings largely indicate that although there are various, group form of ending violence against women ecosystem, true disability inclusion is limited. It is limited, it is tokenistic in many cases, and those same women and girls with disabilities are rarely given real decision-making power. And I think we've been able to demonstrate from the respondents across the three countries that is the true feeling so far, and that despite efforts towards more meaningful engagement, this subgroup, who are women and girls with disabilities, continue to face high level of violence, and this violence spells from emotional, physical, economic, sexual, and as well as institutional violence. We've been able to provide disaggregated data across all those types of violence, which further then increase their dependence on caregivers, societal attitudes, having inaccessible justice system, poverty, as well as restricted access to crucial services. And therefore, that forms perhaps three of our top recommendations in terms of EVAC movements, prioritizing meaningful inclusion across leadership, programming, and service delivery. And this should include formal representation of women and girls with disabilities in the actual governance, decision-making process, as well as agenda setting, and achieving equitable and effective outcomes in East and Southern Africa will require really transforming these movements to be inclusive, accountable, as well as intersectional. The other one would be to the organizations of persons with disabilities. These organizations should strengthen advocacy and visibility for women and girls with disabilities within those platforms, to align, of course, with the SDG on gender equality, as well as the reduced inequalities in SDG 10, in the spirit of leaving no one behind and safeguarding accommodation, crucial relevant budgets, and staff capacity. So we look at the governments and the funding partners. Governments and partners should really prioritize strengthening policy enforcement and legal accessibility to ensure women and girls with disabilities can fully access justice, ensure communicative tools are available, and qualified personnel to implement the policy. The right of that is that there are a number of policies, and we have highlighted this on the reports, that have already outlined most of these guidelines and best practices. However, the implementation and also, taking up of the same in the movements then still seem limited for the reasons and varied reasons and areas that we have already discussed. So we have about 3 key takeaways, or 4, in terms of what COVAW and DEWA could do. Focus on tailoring, training to build gender equality and social inclusion, leadership among women and girls with disabilities, strengthening leadership across East and Southern Africa. And these efforts then aim to empower women and girl leaders as leaders and decision makers. So at program level, that is something we can be able to undertake, but we've spoken about at movement level, at OPD level, and at government and funding levels, what could also be done. So there's also an important thing around skill transfer and replication, to ensure that skills gained by trained women with disabilities are effectively shared with OPDs and EVAC movements, supporting sustainable capacity building for disability inclusion. Again, these recommendations comes directly from what the respondents have mentioned, saying, for instance, when I was trained as a peer facilitator, then I was able to communicate better, understand the issues, and participate and actually be involved in decision making. So again, we cannot underscore the issue around capacity building and skill transfer. Sustainability through stakeholder engagement. I think we can never underscore issues around stakeholder coming together as partners, government, private sector, to implement the subject matter on issues around policy and sustaining disability inclusive practices within the EVAC movement. So that should still be an area that should be focused on, as well as working on reliable data. I mean, this is one of the first steps in terms of picking data to even dissociate all these objectives and indicate at what levels they are in the different countries. And I think COVAW has done a great job in trying to do that. We should continuously do comprehensive surveys that will provide accurate data on women and girls with disabilities to guide advocacy, policy, as well as all interventions to really ensure inclusive support. As you can see that on this one, we have almost 5 objectives in one study, continuously and resources allowing and time allowing. Each of those objectives, in our view, were actually a research area. And so you can actually, break down even the findings for each of these objectives into even smaller and, easily understandable issues that are able to be directly addressed towards the journey to ensuring, participation is at top level and a desired level for women and girls with disabilities in these movements. So that's really a quick takeaways that we wanted to share. There is a full report for this research, which is detailed. We tried to compress the findings in this 1 hour presentation, but we are happy to share that information. We're happy to get, I was not able to look at the chat. I don't know if there are any feedback already coming through, but we'll be happy to respond to those. But I will give Jen a minute if you want to say something, then we take it over back to Christine. Thank you.
Sure. Thank you. Thank you, Bill. I've seen in terms of intersectionality and overlapping of challenges, multiple operation across the three countries. We looked at internationally because our sample size was small, so widely engaging on the secondary data to be able to give us more information that we looked at into the sample countries. So I think that could be a concern for someone, that how come only the small sample size. So in terms of intersectionality and overlapping of operation boiled across the gender and disability fraternity. Thank you.
And back to you, Christine.
Thank you so much, Bill and Tim, for the elaborate presentation. Yeah, it was quite a huge amount of information. And I think now our colleagues in the call are now ready to engage on this further. Thank you so much for putting this together. And once more, I sincerely thank all the stakeholders that took part in this. It has been a long journey, but we are here, and we thank God for having taken part in this and having made this process a success. So we can, I don't know what, can we give you 2 minutes to take water? Then we come in with the questions and the Q&A session.
Sure, I think that would be fine. So do we come back in at 12:05?
Yeah, 12:05. Huh?
Yeah, that would be just about 5 minutes or so.
All right, you can take water and refresh so that you take up the questions. We have a number of them on the chat box. Gemma, thank you so much. Gemma has left, but she had a number of questions on the chat box. So we reconverge at 12:05. I continue with the shout outs. There is Ascend Women's Organization. Thank you for joining. Site Savers, Malawi Network of Women with Disabilities. Some colleagues have put in acronyms: MICGBV, NAA, Narok Albinism Association, we see you. We have Women for Change, Next Step Foundation, Kibera Deaf Girls, Kudeya. Kudeya is the one for domestic workers, and it's quite a long acronym. Huh? Africa Sex Workers Alliance, and UNESCO. Yes, there's one. Sungani from Segwid, CEWGWDI. Yes. We see you, we acknowledge you, and we thank you for your time. All right. I hope now you have refreshed and taken some water. So we open the floor to now a Q&A session and discussions on this, further discussions on the findings that have just been presented. So I have noticed National Gender and Equality Commission and Trocare Malawi are also in the room. You're welcome. Yeah, so please, if you have a reaction, you have a question, comment, input, please put your hand up, or you can put it on the chat box. Yes. Any comments, questions? So as we wait for the hands up.
Hello, team. Hello. Hello.
Yes.
There's one Ismail.
Yes, Ismail. You're most welcome.
Can you hear
So
me?
it's finally here. We really looked for you to make some remarks. You're welcome.
Poleni sana, apologies. I wasn't able to join at that time. Yes, my name is Ismail Odem. I work for the State Department for Gender Affairs and Affirmative Action in Kenya, and particularly within the Gender-Based Violence Mitigation Directorate. I'm happy to be here and to have listened in from around maybe 11. The presentation was being done. So I think for me it's just to underscore the commitment on behalf of government in terms of ensuring that we prevent and respond to gender-based violence. Okay? And as we review, has been reviewed, but it's still undergoing some various processes, including parliamentary approval and cabinet approval before we can officially launch it. But I can say without fear or favor that persons with disabilities have been critically looked at when it comes to the policy. And also, of course, as a country, we're also making a lot of progress. Last year, we passed the new act amended by the president and PWD Act of 2025. So we are making all efforts to ensure that we leave no one behind and to ensure that collectively we are looking at PWDs not just as a by the way, but actually as the main group in everything that we do, okay? Including affirmative action programs that we run within the State Department. We have the Women Enterprise Fund and the National Government Affirmative Action Fund. All of these funds have set aside not less than 5% of their beneficiaries to be PWDs. So I think for Kenya, we are making deliberate efforts to ensure that PWDs are part of our, we focus for PWDs as part of our, in our programs, in our projects, and of course in our policies. But maybe just as the presentations were going on, I got to realize that the three countries, Kenya included, we have almost common challenges. But we, as a country, Kenya has made deliberate efforts to ensure that we include PWDs in every sector of our economy. I had the facilitator talking about transport. I can confidently say that for public transport like rail, okay, like for the standard gauge rail to Mombasa, and for the local rail transport within Nairobi and its outskirts, they have provisions to take care of PWDs. I myself am a wheelchair user, and I comfortably use the train whenever I need to move around to Nairobi or Mombasa. Okay, so we have made those considerations. We are also taking care of a lot of issues when it comes to provision of health services, and especially sexual health and sexual and reproductive health for women. That is widely talked to in our Disability Act of 2025. And some of these things will take a while to implement, but we envision a country where women with disabilities, one, are not forced to partake any drugs um, when it comes to sexual and reproductive health. They do it on their own will. And if not, if the disability maybe doesn't allow, then their caregiver or parent must give consent before any woman or girl with disability is given any drug, especially when it touches on sexual and reproductive health. We also have free medical services, government hospitals for PWDs, which is in the Act. It might take a while to implement, probably 2 or 3 years, to start factoring in that in the budget. But I'm sure with time, because it is in the Act and there's a lot of goodwill from the government, that will be implemented. We also have tax exemption, not only for the PWD, but for caregivers of PWD with severe disability. They also get some element of tax exemption, although not full, but to some percentage, depending on the disability. So we have moved, we have taken steps. We, as employment in all appointive or elective positions must be PWD. Although as a country in our public service, we are currently approaching 3%. We are not at a 5%, but putting all the effort that we can to ensure that we get there in the shortest time possible. Actually, in the last 2 years, the government has been able to employ to have an additional 1.5%. By 2022, we were at 1.5%, but now we are approaching 3%. So we are doing quite well. I must say that as a nation, we remain extremely committed to ensure that PWD gets adequate services. And even as the government looks to step up the construction of protection centers that are run by government, PWDs are, are in the back of our mind. We will ensure that those centers are disability friendly. Okay, we are not looking to build specific facilities for PWDs or specific centers, but we want to make sure that those that will be there and will be run by government, disability mainstreaming within the same structure to ensure that GBV survivors who go through those protection facilities get all the help they need. They are also in the process of reviewing the national policy on gender and development, and we would also, appreciate to work with COVAW and the other organizations just to make sure that by the time we get an end product in terms of the policy, PWD issues are mainstreamed. Yeah? And also, as I finish, currently we used to have education bursaries or support from the National Council, but the government has made a deliberate effort to mainstream that and ensure that for every point of service where there are bursaries, we put aside 5% of the bursaries for children or students with disabilities, whichever the case. So I think those are part of we are trying to mainstream disability services. Not only a stakeholder within government that is offering these services is now instructed to set aside 5% of these benefits, yeah, to ensure that PWD get access to these services instead of referring everyone to the council. So I think the country, that is what I can say, and I'm really happy for this survey that has been done by COVAW and other partners. I think it will help in policy formulation even as we forge forward as a country. But I must say, even as a PWD, that as Kenya, we have come a long way. We still have a lot to do, but we must give credit where it deserves. Thank you so much.
Thank you so much, Ismail, for those remarks and for reflections on the presentation. That's the good thing of having talked after the presentation. Yeah, so we are going to have, we have 14 minutes left, and we are going to engage the consultants and the stakeholders in a discussion. So the reactions we have and any questions that anyone might have, if you have a question, just raise your hand up. So as we are waiting for colleagues to raise their hands up, maybe we can start with the questions on the chat box. So there's a question on that.
Yeah, excuse me, Christian.
Yes, Jen. Yes, Jen.
Yeah, just a follow-up from Ismail in terms of our takeaways. There was something he has mentioned about tax exemption. It's a policy issue that the Ministry of Health has a criteria that they are using to assess, and many women and girls are feeling left out because of the strict criteria. So it's a suggestion, and maybe you can comment on it later, or you can take it as a takeaway so that you follow it up with him as a project, because there are so many tax exemption. The process, the criteria of giving these people a certificate of exemption is so tedious, and leaving out some, because it's rigid. They are leaving out, if you had an accident, that's not normal. So he knows the criteria. So maybe you take it up as one of the takeaways, like we said, one that partnership with the government on way forward. Thank you.
All right, thank you, Jen, for pointing that out. And I believe Ismail has taken it up. The issue of barriers in tax exemption for women with disabilities. Yeah. So in the
Hi, Christian.
Yes.
In the interest of time, perhaps we want to just quickly address some of the questions on the chat box.
Yes. That's
then we move forward.
Yes, the first question.
Yeah, let me just go.
You have read it,
seen them.
Okay.
Yeah, I've been able to check them out.
Go ahead. Right.
I think Rose is saying that good presentation. There's on gender and intersectionality. What unique challenges do women and girls in psychosocial disabilities face compared to others? And I must say that that's a really important question. When we looked at the psychosocial disability, it's one of the most I don't know whether the right word would be in understood kind of disabilities. In Malawi, for example, the women who had psychosocial disabilities faced compounded exclusion due to limited recognition of mental health needs within the frontline GBV services providers. So they actually are assumed or sometimes not recognized and categorized as persons with disability, and therefore their issues are not quite addressed in clarity, are not understood by the service providers. And in that case, they actually face sometimes very compounded exclusion. So that is what we would say specifically in terms of psychosocial disabilities compared to other forms of disability that are fairly well understood, more visible, if you may use that word, or more detectable by caregivers and other community members. I particularly also want to look at the question that we talked about in terms of trend analysis. I think Gemma had talked about was trend analysis specifically for different sections possible with the limited data. Again, this is one thing that we highlighted on limitation of the research. But importantly is that we've been able to do deep analysis based on each of the specific objectives. However, he also has suggested that, of course, there is a greater opportunity to utilize the larger literature review information to concretize those. But one is that was not really part of this research, but it's, I think, an ongoing discussion even as we build up and as we go on into further deep diving into this study, and for those who even want to take subsections to continue studying them deeper. He also talked about percent measured perceptions. He had checked whether are those perceptions the ones that were observed by the consultants from the groups, or was it the participants' really response? And we just want to emphasize that, yes, these were perceptions that were submitted by women and girls with disabilities that were surveyed. So it was purely based on their responses and not perhaps made up findings based on literature review. Where there was literature review, then we only used that to substantiate or actually corroborate the responses that we were receiving. Dr. Tiller had asked something about were individuals from, I think, the rural or informal settlements included in this process. And they say yes, actually across the 3 countries, we sampled both urban and rural communities. To start with, for instance, in Kenya, we did Nairobi, which is largely our urban, it's our capital city. And then we went into villages in Narok.
Kibera in Nairobi.
Pardon? Yeah, and even Kibera in Nairobi, which is really like an informal settlement. So we ensured across the 3 countries that there was both urban and informal settlement responses. And when we looked at, if you remember during our presentation, when we looked at whether there were major disparities in terms of responses, it was interesting to learn that across both the very urban and also very informal settlements, that some of these factors were cutting across, and that was one of the interesting findings that we discussed as we were providing this presentation. Jen, have you seen additional questions that you want to respond to? I think the rest is, I think Gemma has put in a very important write-up there. Christian, he said, thank you very much and congratulations to COVAW and partners for this important piece of work. He wants to acknowledge the value of the study. It brings forward something that we don't often see clearly enough in our work in terms of ending violence against women and girls, which is actual participation and inclusion of women and girls with disabilities within the movement and systems. So he says what is particularly powerful in this research is the way it captures the lived experiences, and that is brought by the voices and perception shared that would really help ground the issue in reality. And they highlight that barriers are not only external, but also exist within institutions, services, and sometimes within movements themselves. So inclusion is just not about presence, but about meaningful participation, influence. And I think we've talked about this deeply, and I can't agree more with Gemma Woods on that. And that has important implications for all of us, whether we're in government, civil society, or partners, to ensure that the issue around meaningful engagement is actually in the underlined word meaningful, and not just engagement for convenience or to tick boxes, so to speak. Jen, have you seen any other questions or comments that you want to quickly speak to? The rest are really just individuals saying, yeah, go ahead.
Yeah, there's a question by Sungani Ngondwe. Are there recommendations to align community bylaws with national disability and GBV frameworks?
Oh, yes, I think I read that. Jen, do you want to take that? Are there recommendations to align community bylaws with national disability and GBV frameworks?
Yeah, I believe every country has a has a policy and disability policy, and government bylaws. So it depends with which community, and the community will subscribe to the laws of the day. So it has to be incorporated.
Yeah,
So I
I
don't
would,
know
I would
whether,
also,
yeah, but
yeah,
whether
no,
this is
I
a
would,
special case, like which particular community is which particular community, because it per country specific. For example,
the frameworks are different, yeah.
the framework, there is an international policy that is like we said, the Africa Charter, that covers across, and all the Africa countries, member states subscribe to it. So per country, there are specific bylaws per country, trickling down to the grassroots. Yes.
Yeah, and you just add that the process of policy formulation and frameworks is in itself participatory, and I think involves all stakeholders, and that is a good intersection to ensure that if there are any community bylaws that are useful in informing any of the national disability and gender-based violence frameworks, then they find a place into that collective participatory development of policy approach that is utilized across the countries. And that really should be an opportunity, Sugani, that really says that, yes, I think there is a place, and I'm sure even the current policies have already consumed as much in their current form.
Hello, I don't know if you have addressed the one on the by Rosie Mtesi. We're saying that thank you for the good presentation. However, on gender and intersectionality, I have a small question. What unique challenges do women and girls with psychosocial disabilities face compared to others? I don't know if that has been.
That's the first one we addressed comprehensively. Maybe you may have missed it, yes, but that's done already.
Okay, thank you so much.
Yeah. Christian, any
right.
questions? Yeah, back to you.
So I cannot see any other hands up. So I will hand over to my colleague Chilufia to wrap it up and hand it over to Ruth to close it. Thank you so much. Chilufia, over to you.
Thank you so much, Christine. Thank you, Edrak. What a wonderful presentation. And as you can see in the reactions, we really want to thank you for this piece of work. It has brought a lot of insight, and we hope we can use this going forward. This time around, I would like to ask, I don't know if Rosie Mtesi is around to do a vote of thanks. Rosie Mtesi from Rwanda. Are you in the room?
Yes, I'm here. I'm here.
Please, you can start with closing remarks, and then you'll be followed by Madam Ruthie to wind up. Thank you.
Thank you so much for this opportunity and giving me this time to give closing remarks for the research validation meeting. I personally am called Rosie Mtesi from Rwanda, heading organization that advocate for the rights of women and girls with psychosocial disabilities. Dear esteemed advocates, partners, and participants, as we come to the end of this research validation meeting, we would like to extend our sincere gratitude to each of you for your active participation, thoughtful reflections, and valuable contributions in validating the findings of this important research. On this participation of women and girls with disabilities in ending violence against women and girls movement across East and South Africa. Your insights and feedback have enriched this process and will play a critical role in strengthening the final report and ensuring that it truly reflects the lived realities and experiences of the community represented. This research is particularly significant as it provides vital evidence from Malawi, Kenya, and Rwanda, helping to highlight the unique experience, barriers, and opportunities facing women and girls with disabilities. In this context, such evidence is essential in informing inclusive policies, strengthening advocacy efforts, and shaping responsive programming and advancing meaningful participation and representation. Where there is no participation and representation of girls and women with disabilities, there will be nothing to be done without us. Nothing without us should be implemented. We would also like to extend our heartfelt appreciation to all partners who supported this research process, and in particular to the UN Trust Fund for the generous support and commitment to advancing inclusive initiatives that promote the rights and participation of women and girls with disabilities. We further acknowledge and appreciate all members, researchers, and stakeholders who contributed their time, expertise, and experience throughout the research journey. Beyond this research, we celebrate the continued collaboration fostered through capacity building, training, shared learning opportunities, and collective efforts towards promoting gender equality and disability inclusion within feminist movement and advocacy spaces. As a fellow participant in this journey, we remain hopeful that the validated findings from this research will inform strong advocacy, inclusive programming, and impactful action across the region. Thank you once again for your dedication, engagement, and the continued partnership. So on behalf of my country and other fellows advocates, I would like to thank you very much for giving me this opportunity by giving a closing remark. Thank you so much.
Thank you so much, Rose. Thank you for your kind words and the determination, and we really thank you for everything. So I'd like to just call upon Madam Ruth Kutumula from DIWA to just give us the next steps and also wrap up the validation. Madam.
Thank you so much, and good afternoon. I really enjoyed the presentation and the level of participation this afternoon. Thanks once again to the consultants who have done really wonderful work in making all these preparations and ensuring that we can have this report at hand. And again, a huge thank you to our participants, those that participated in the research in all the 3 countries, and also the key stakeholders, the women rights organizations, and government people that were also in participation. Indeed, I think as we can see the findings, it is very clear that there has been indeed gaps in terms of women's participation. And going forward, I think this piece of evidence helps us to really begin to plan and ensure inclusivity, because we are doing various projects like the women's rights organizations, the feminist movements. They're already doing projects that are empowering women in general. why not include women with disability? Because before disability, we are women first. So it's very important that this piece of evidence can be used to inform our programming. I call upon all stakeholders that let us use this information, let it not be on the shelf, but let it be something that will add value to our work and ensure that we are not leaving anyone behind. As we can see that DIWA and COVAW have already begun this journey in terms of supporting women with disability to be in these key spaces, such as the Commission on the Status of Women, the CSW 69, CSW 70, and also we supported women to attend in the Women Deliver Africa, but also most key important platform is the one that we have been holding, the sub-regional convening that has been held previously in Kenya, but also Malawi, providing a space where women could do articulate their issues and build their confidence and strategize how they can be part of the movement in ending violence against women in East and Southern Africa. And more importantly is the fact that we are building the capacity of women, the capacity in terms of leadership and their advocacy, that as they come onto stage, that they can be able to, advocate powerfully on issues that concerns them. And of course, I really appreciate all the women that participated in these spaces, including the engagement that took place in Banjul, where we were also talking about issues of access to justice for women with disability. And so I do invite our partners and stakeholders that even as we will be coming to an end of this project, but this evidence will go a long way because generally in Africa and perhaps worldwide, there is a really gap in terms of research, in terms of data on women with disability. So this acts really as one of that is contributing to key evidence and statistics on women with disability. So we ask that as partners, let us work together. We are very open to work together to really advance rights of women and girls with disability. Coming to this juncture, I really appreciate everyone, and we look forward to the final product, which we are going to ask that you participate in dissemination of that report. Thank you once again. Thank you.
Thank you so much. I've seen a last question, Christine. Maybe you can come in. People are asking, how do we get hold of this report? So Christine, please come in and then we close.
Before I come in, Jen wants to say something.
Yeah, I was just requesting for people to take a picture so that we can also add that to our report as validation. So if at the end of it, you will request people to show their face and we take a picture.
All right, it's noted. Okay, in terms of the final report, we are going to consolidate the report further from the input from this important validation, and then it shall be circulated within our networks. We have the contacts of most of the stakeholders or colleagues who joined. But for those who we don't have, please just drop us your email on the chat box so that once we have the final draft, we will share it with you. Thank you so much. Chilufia?
Thank you. So like Jen said, that we switch on our cameras. That is the last activity, and then we can close. Jenny, over to you. Hello, Jenny. You are muted.
Oh, sorry. I'm not seeing, but I think Christine is in a better place to do that because she's the host and she can, yeah, for me, I'll just take the few that I'm seeing, but Christine is better placed.
Okay, Christine, you can
I'm seeing a number of persons.
Yes.
And Andy is very serious. She's not smiling. Yeah. Well done.
Okay.
Done?
Great. Yeah.
Okay.
Thank you all very much.
Thank you so
Thank
much.
you. Thank you
once
all.
again. Thank you.
Please,
Thank you so much.
on your way out, just register on the link once more. We would like to get a list of the stakeholders that supported in this. Thank you so much.
Thank you.
After Sana, Christine, and the COVAW team, you are on the team. Bye-bye and good afternoon.
Bye.
Bye.
Thank
Bye.
you. Bye.
Bye.
Bye. Thank you.
Thank you, everyone.